right, ladies and gentlemen, we have our speaker in the house, so let's be mindful of his time. Welcome to Olive Connect and Create. We have Dr. Omar Salama today talking about common ailments of the ankle and feet. Thank you again for your time. A quick introduction for Dr. Omar. He was born and raised in Southern California. He is passionate about movement, exercise, and living an active lifestyle. Omar graduated from Cal State Fullerton with a BS in kinesiology in 2014, and then finished his doctorate of physical therapy in 2017. He's currently an administrator at a skilled nursing facility at College Vista Post-Acute in Eagle Rock, where skilled rehab and nursing services are provided to patients recovering from different conditions in order to assist with community reintegration. So thank you so much for being here today and joining us with Olive, and go ahead, take it away.
Assalamu alaikum, everyone. Are you guys able to see my my presentation here?
Yes.
So yeah, firstly, apologies. The last time that I was scheduled, I had to cancel last minute because I had the Department of Health stop by, and that's kind of a routine visit. It happens in nursing homes. Just they check for compliance and that sort of thing. So it can happen at any time. It's usually not scheduled. So I do apologize for that. So today I was asked to speak on different ailments and issues regarding feet and ankles. I will be honest, and this is not one of my stronger areas of expertise. Normally, you know, if we talk about back or knees, the neck or shoulders, those are some of the things that I dealt with more in my practice. But I've definitely been exposed to it. I do know some basic things. So today's talk will be a little less technical, but that might be better. That might be better in a lot of ways. We'll go over just some very basic anatomy, just so we can appreciate the complexity of feet and ankle related issues. We'll talk about some positioning related to the feet and ankles, and then a couple of major ailments that I saw in my practice, and then some general exercises that are kind of out there that I would recommend just everybody do, regardless of if you have these issues or not. And chances are we've all dealt with some of these on some level. And then lastly, we'll get to questions if you guys had any. So we'll jump right into it. And just very briefly go over the anatomical structures. So feet and ankles are very complex. You have 26 bones, and these are just kind of estimates because depending on who you ask, they might say, well, this is actually not a joint, or this is a joint, but it's 26 bones, 33 joints, 107 ligaments, and 19 muscles in a relatively small area. If you compare that to the shoulder, there are a lot of muscles, but it's essentially 3 bone structures or 4 bone structures. Same thing with like the hip. But in the feet, you have all of these little muscles working together. You have lots of little bones, obviously a lot of ligaments. So it presents a lot of possibilities and opportunities for injury. Structures that are commonly focal points of injury or pain are the plantar fascia. So that's, we'll get into that a little bit more, but that's a very thick combination of soft tissue underneath your feet. It travels from the heel to the toes. Ankle ligaments, so those would be kind of around the, if you can see my cursor over here in this area, just strictly speaking, the ankle. Bunions, and then neuropathic pain. So a lot of people experience like a tingling, buzzing, sharp pain in their feet, and they think it's a foot-related problem, but in actuality, it's a radiating pain coming from the back, or even a peripheral nerve down the chain. Right here, we have some just general understanding of the different positions that your ankles can be in. And there are other positions, but these are fairly, we're just gonna keep it very simple. So Over here, the top one right here, this is neutral alignment. So if you drew a straight line from your calf down to your heel, this is just neutral alignment. If you were to leave a footprint in the sand, it would look something like this top line. Secondly, we have what's called supination. So that's when you turn your ankles inward. So it would be like standing on the outside of your foot. That's called supination. And that's a high arched print. So if you were to step into the sand, you would see less of the midsection of the foot. And then you have flat foot or pronation. So that's when you really flatten your feet and you're pointing your ankles outwards. You can see if you draw a line down from your calf, it goes on the right foot towards the right. And if you were to step into the sand with that foot positioning, you would have a much more flat foot positioning. Now, this is important because your gait analysis, or the way you walk, your ambulation naturally pronates and supinates. So when you are in stance phase, so that's when your foot is, you're putting the most amount of weight on your foot, you're in pronation. So you're in a relative pronation, I should say. So you're closer to this option over here, which is the last option. You're closer to a flat-footed positioning of the ankle. Not quite this extreme, but it's a little more of this. When you are in a swing phase or initial contact, so that's when you get to that heel touch in the gait phase or the ambulation phase, you're in supination. So you're a little bit more of the high arch positioning. These are extreme, demonstrations of that, but this is relatively where you want to be. Now, if you don't follow that, you might have a weakness in some of the musculature. You might have a skeletal problem. Could be a coordination issue. And then that's where you're going to see a lot of pain. So plantar fasciitis, this is a very common one. I treated this a lot. So it's kind of like what we talked before. The plantar fascia is this very thick fascial layer underneath the foot from the heel all the way to the toes. It connects with some of the musculature coming from the calf. Down over here, this would be your Achilles tendon, and it inserts onto the heel and kind of connects through over here through that plantar fascia. It can get inflamed. It's commonly associated with poor positioning of the foot. So sort of like what we talked about in the previous slide, if you're doing any of these things incorrectly, it might lead to plantar fascia. If you stand for a long time, if you're on your feet all day, it could also lead to that. Immobility in some of your joints and the bones in your feet might lead to that as well. It can manifest as burning, sharp pain, stabbing pain. Commonly treated with calf stretching. Calf stretching is very important. Some massaging on the bottom of the feet. So you're trying to smooth out that plantar fascia. There's some debate as to whether or not you can truly massage it just because of how thick it is, but you can definitely get some pain relief from doing that. You would also work on some joint mobility to try to loosen up the bones in that area. And then definitely motor coordination and strengthening. Next are bunions, also called Hallux valgus. I used to see this a lot more in women than men, and the reason is women tend to have more stylish shoes than men. A lot of those shoes are pointed, and so that compression leads to the toe kind of pointing inward like this. And what will happen is it creates some instability with one of the bones at the base of the big toe, and it'll start to kind of merge out a little bit. You can also get this from excessive pronation. So if we go back to that second slide, this is pronation here. When you're very flat-footed, it makes it easier for you to develop this bunion here. Usually hurts to touch it. So classic sign would be I would poke that bone on a patient, and all of a sudden they would say, "Ow, that really hurts." Problem with this is that it eventually leads to a lot of stiffness, and it makes a normal gait pattern much harder to do, and it leads to a whole bunch of other issues and pain. A lot of physical therapy treatments come down to the same type of stuff. It's just knowing what structures to manipulate. But soft tissue mobilizations, just a fancy word for massaging. You want to gently mobilize the bones around, or even that bone specifically. Big focus is on improving the range of motion of that big toe, because your body will inherently try to protect that toe and not want to move it. Orthotics will help, especially to prevent excessive pronation. And then you want to strengthen the foot so that you can try to keep it in a proper position as much as possible. And next, and this is the primary part of the presentation, is just some general exercises for good foot health. You know, a lot of us, you know, myself included, I've experienced some plantar fascia related symptoms. And the reality is maintaining a nice regimen of preventative exercises or stretches is your way to go. And you'll find that a lot of these exercises, we would use them for people with the two conditions we spoke about, as well as others. So the first one is a good calf stretch. There's two different kinds here. A nice calf stretch is important to having what's called dorsiflexion. So this position that this gentleman here in this image, this art, where the ankle is bending towards you, you can see it more exaggerated here. This is important for proper foot health in the gait cycle. So in order for you to properly walk, you need to have this range of motion. If you don't, you'll start to excessively pronate, and if you don't excessively pronate, you'll have other habits that kind of come about. So this is crucial. The two that we have here is a bent knee versus a straight knee stretch. So over here, you have a gentleman stepping forward into the stretch. The back leg then is, you want to keep the heel on the ground. Over here, he has his hands on the wall to maintain his balance. You can use a chair or some other structure. And you stretch that back leg. You should feel the stretch down in the calf over here. You don't want it to hurt, but it's not a very pleasant stretch. So you might have some burning in the calf, but you don't want to replicate any symptoms. So that's a general rule in any exercise. You never want to replicate the symptoms that you feel. So say you have a bunion, say you have neuropathic pain, say you have plantar fascia, whatever you're doing, you don't really want to replicate that pain unless it's under the supervision of a therapist. The second version of this is to bend that back knee. So say you get into this first position right here with the straight knee, then you want to bend that back knee, and that'll get you a little bit of a deeper stretch. You want to keep your toes on the ground, and you want to keep your heel on the ground as much as possible. The next one right here is a nice plantar fascia rollout. I mentioned earlier that there's some debate as to whether or not you can truly stretch out the plantar fascia because of how thick it is. But you can definitely relieve pain by getting some soft tissue mobilization. You can buy these on Amazon, Big Five, Target nowadays, anywhere you want. They have different versions of this. I don't really have a version that I would recommend at all. It's just kind of personal opinion. You could even use a home item. You could use a jar. It's not like a can. Not like an aluminum can. You want to use, a heavy duty can, like a can of beans or that sort of thing. And what you would do is simply, you'd either do this in sitting or standing, but always make sure you have proper balance. And the nice thing is you can control how much pressure you're putting on. And then you would roll back and forth, just like the picture implies. And you would feel some tenderness there, but ideas afterwards, you would have some pain relief. A third one, which is good for some of the intrinsic muscles. So I mentioned that there were 19 or around 19 muscles associated with the feet and ankles. A lot of those muscles, especially in the feet, in the calf and the ankles, you have larger muscles, very strong muscles. But when you get into the feet, you have little tiny muscles. And you want to make sure those muscles are operable. It's hard to exercise those muscles in a gym. If you do a squat, you may work out some of those muscles, but you're not going to isolate them. So over here, this is a towel grab. You can do this in standing or sitting, just depending on your balance. But you would essentially sit down with a towel under you, and you would curl your toes, trying to gather up as much of the towel as possible. And this is really nice for that, like I said, those intrinsic foot muscles. And you would work on strengthening coordination and mobility. Another one here, I think this is our fourth one, are toe and heel walks. And just like the name implies, you would walk up on your toes or your heels. You can control the distance. So you could say 10 yards, 2 or 3 times for each different kind of walk. This is nice because you're working opposite muscles. So when you go up on your toes like this, you're focused mainly on the calf. When you go on your heels like this, you're focused on the front muscles. And the front muscles are ones that we tend to neglect because the back muscles are so much bigger and we focus on those. But you do want to have your front muscles exercised and the range to be there. The nice thing with the heel walk, not only are you working those front muscles, but you're working on some range of motion. This is that dorsiflexion that I was talking about that's so crucial for the way we walk. And that's really what you're achieving with the calf stretch. You're getting more dorsiflexion or that front ankle motion. Another one is a good single leg balance exercise. The important thing here is, going back to the second slide, you want to try to maintain this neutral alignment. So if you're standing on one leg, you know, and of course you'd always have balance. You don't want to be in this position or this position. You want to keep it as neutral as possible. Oh, here we are. Yep. You want to progress to, you know, no hands, but if you need to hold on, that's okay. I would tell my patients, start off with 2 hands, 1 hand, 2 fingers, 1 finger, and then no hands eventually. And lastly, we have an ankle inversion and eversion exercise. This goes back to the second slide. And again, the ankle does have some other motions, but these are really the primary ones when we deal with foot ailments, especially in the beginning. You want to tease these out. So supination is another way of saying inversion, and pronation is another way of saying eversion. So over here you have the supination, or I'm sorry, I'm getting them mixed up right here. This is the one where you have supination or inversion. So you're starting in a neutral position like this, and you're moving the ankle inward like that. And you can even see the musculature over here being flexed a little bit. You see the inside. This is a tendon, so that muscle is being worked out. When you do the opposite, you start over here and you move out this way, eversion, you move out to the outside, you see a little bit more of these tendons firing. You see this one really popping out. And that helps strengthen the coordination, or to improve the coordination that you're going to need in the gait cycle when you need to naturally have these motions. You would start off with doing these in a sitting or a laying down position, and as you get stronger and you have more control, you would do them in standing. Now these exercises, all of these are not heavy lifting. They're not a bench press. They're not squats. You're not working out major muscle groups, with the exception of the calf, which, as you can see over here, is a pretty good sized muscle. You want to focus though on coordination. So for example, this gentleman, or what looks like to be a gentleman, he starts over here in this position. He then goes into the inversion. He brings his feet inwards. When he returns back to this position, he's coordinating it. He's going nice and slow. He's controlled. You're not gonna, let's say if you were doing a curl and you lift your arms this way, you wouldn't just release it down. You're up over here and you control it on the way down. And in the foot and ankle, that is especially important because you're not generally doing these massive power movements. Most of us are not trying to dunk a basketball anymore. We're walking. And what you need for walking or stepping up on a step stool or a ladder or walking upstairs is coordination. So that's my advice. We went over as 1, 2, 3, 4, 5, 6 exercises. Some of these have 2 parts to them. I myself do some of these, especially the calf stretch, the plantar fascia roll, and the toe and heel walks. That's my bread and butter for me. And I do throw in some single leg balance. I don't do as much of these because at my point, at this point in my life, it's not as crucial. But and I don't have previous ankle injuries. But if you do, you definitely want to work on some of this. So if you guys have any questions, or if you want to talk a little more specifics, I'd be happy to answer some of your questions.
I have a question. Omar, which one is, I know the straight leg and all that is for balance mostly, but what else, like I grab onto the ground with my feet. Like if I wear shoes, it's harder for me to balance. Will that be easier in the future if I keep it up, or you just have to do it without shoes on always?
So you're saying when you wear shoes, you have less balance?
Well, no, yeah, kind of, yeah.
Yeah, and that's because it's harder for those intrinsic muscles. So over here, when we talk about the toe curl, so this is sort of simulating when you're, let's say if you're on a bus and the bus is moving around, you're standing and you're holding on to the pillar. Your feet, you'll feel your toes kind of crawling or trying to grab the ground, and this simulates that. So this exercise right here, the intrinsic foot muscle, or the toe curls and the single leg balance, you may feel kind of a similar feeling when you do both. I would start off with that. Work your way up without shoes, and then you would put on the shoes and work on it. But balance is one of those things that it's not just about the foot and ankle. You're moving up to the knee, the quads, the hips. And if you have weaknesses in also your core, definitely your stomach muscles and your low back. And I think we did a talk on that a few months ago. But if any of those segments in the chain are not pulling their weight, you're going to feel extra work in the feet, and that's probably why you have all that grabbing. But definitely start off barefooted, and then when you get to a point where, let's say you're doing single leg balances, balance work for 20 seconds without hands, or very minimal usage of hands, then maybe throw in some with shoes on, because we're going to use a good chunk of the day.
I have a question. I've been having this ankle issue for quite some time. It started about a year ago, and with some prescription medications and regular painkillers, it kind of went away. I thought it was just like inflammation, but again it came back. And then I saw foot and ankle doctor close by, and they recommended some kind of exercises. And I'm doing the exercises and going to physical therapy. In the beginning, the physical therapy was all right, but today was my 12th session. And now for the past few sessions, I've noticed that every time I come back, it hurts a little more, but towards the end of the day, it kind of really releases the pain, and I don't feel as bad. So my MRI is scheduled for this coming Saturday. So I will know more about exactly what my situation is. It says the what you call perennial tendon dysfunction. So in earlier you had said that physical therapy or massaging, the massaging really doesn't help. So in my part of my physical therapy, there is like 8 minutes of massaging is involved. It really feels good, but is it hurting more because of the massaging?
So just to clarify, so when I say that there's some debate as to whether massaging the plantar fascia in particular, which is the bottom of your foot right here, there's some debate as to whether or not you're really stretching that fascia or not, just because of how thick it is. That's not to say that it doesn't lead to improvements, because it does feel good, and you can have some pain relief. I'm one of those that I would always do it. I used to go to it a lot. But I was just making a comment that there are some out there that would say they question the efficacy of it. Now, you mentioned perineal tendon dysfunction.
Yes, that's what. That's why they are planning to do the MRI.
Yeah. So that particular perineal muscle group is on the side over here. So
yes, yes.
So it's the outside of your leg. So if you're looking at the right foot, let's say, it would be on the right side of your calf going down to your ankle. So those muscles start up over here in the calf. They go down into this area, this bone that sticks out. It's funny that you mentioned that, because I was going to include it here because that's also a very common one. And the approach, and like I said, with therapy, it's generally the same approach. You want to loosen up tight structures, and then you want to strengthen weaker structures. That's therapy in a nutshell. And so I would do, when I've seen perineal tendon or musculature dysfunctions, I would definitely go to soft tissue mobilization. Sometimes that might mean the plantar fascia. A lot of times it means directly onto the perineal muscle group. Now you mentioned that it hurts when they do it, but you feel better towards the end of the day.
Not when they do it, like maybe a couple of hours after, and then it stays like that for some time. But towards the end of the day, it's really relaxed.
Okay, relaxed more than.
But less pain, I would say.
So less pain than when you started.
Yes.
Okay. Yeah, and that's so you have a structure there, a tendon that has some sort of dysfunction, whether it's a small tear possibly, or over usage. It could be different things. They're touching it, but they're touching it with the intention of stretching it out or to calm it down because it's so tight. So imagine if my shoulder over here, you were to go like this for 24 hours. It may not hurt right now, but after 24 hours, this would become very swollen. And if you touch it, it hurts. But at the same time, you need to touch it because you need it to relax. I need my shoulder to calm down. So I would do some gentle rubbing. I might put ice on it. It might aggravate in the beginning, but in the long run, then it calms down and it loosens up and gives out in a good way, I mean. But you likely have, my guess is, and I don't know if your therapist has done that or if they've communicated to you what your walking looks like, but my guess is you're doing a lot of this, you're very flat-footed. That's my guess. Now,
I have very low arch, yes.
Yeah, and that's...
I wear orthotics, yes.
Right, because if you imagine, so think if you're walking like this all the time, these muscles on the outside over here are constantly being shortened. So imagine if this is a rubber band, if I draw a line from the top of the calf all the way down to the outside of your ankle, you're bringing that muscle closer together. If you were to go in the opposite direction, you're stretching it out, right?
Yes.
So the single leg balance, and I don't know if your therapist is doing this, trying to get a single leg balance while maintaining this position or this position so you're not constantly flat-footed is important. The orthotics are good because they're going to try to keep you in more of a neutral position, but you also want to spend a good amount of time trying to teach your muscles to be in this position or this position more often.
Does it, the downhill walk affect more? Because I started feeling it once I started going downhill.
Good point. So anytime you increase the difficulty level of whatever you're doing, your body is naturally going to struggle more. So let's say that I have a hard time with overhand movements or overhead movements, right? If I do it laying down and I go overhead, it's easier because I don't have gravity working against me as much. If I stand up and I try to go overhead, it's going to be a lot harder because now I increase the difficulty of it. Going downhill, now gravity's really pulling you down. You're placing more demand on your ankles and your feet to stabilize in the proper position, like these, this position over here. And so you're probably breaking the rules even more. You're getting more flat-footed. So that's why, probably even uphill, to be honest, as well, but definitely downhill. So my guess is not only are you flat-footed, but you probably have, let me find the picture over here. You probably don't have a lot of dorsiflexion.
Okay. Yeah, they have recommended those exercises.
Yeah, you probably don't have a lot of ankle mobility. So I think massaging is on the right track. They could do a joint mobilization where, that's my cue to plug in my laptop. A joint mobilization where they are, moving the muscle, not the muscles, the bones in the feet and the bones in the ankle to try to get you more mobility, so you're able to do this. And working on exercises to maintain this position as much as possible without an orthotic. So the single leg balance would be good. This one might work, pretty good for you because it'll help maintain that position. Definitely the calf stretch. And honestly, a lot of it is just building an awareness. So I would, when I've had patients like that, I focus on either balance or walking or any kind of activity that they're doing in standing, whether it's single leg or double leg, but just paying very close attention to having that arch maintained. And it's not an easy thing to do because you're trying to undo, years and years of walking a certain way.
Thank you.
I would encourage to continue with the therapy. I mean, if they're doing, those couple of things you mentioned, I would say that they're on the right track.
I have a question about the nerves in your feet, like on top of your foot. I was wondering, okay, I had a problem and I had an operation where they cut one of the nerves. I think he cut it. I think that's what he said, or he took it out or something, on top of my foot, like under my big toe, because it always hurt. And you started to say something about that kind of nerve problem.
Yeah, so I was making the point that a lot of I've had a lot of patients who will say my toe tingles, my calf has burning sensation in it, or just general, my foot is falling asleep. And a lot of times people will think that that's an issue with the foot, but it's actually coming from your back, or not always, but a lot of times it'll come from your back, or it'll come from a peripheral nerve down the chain. So in your buttocks or your hamstrings, and there's an obstruction there. And that's sending messages down to the feet that, hey, there's, like a clogged sink, or there's clogged plumbing on, on the way back. So if you're talking about below the big toe, and I forget the nerve root, but, and I should have included it here. Actually, let me.
That's okay.
Let me see if I can, lumbar spine nerves. So when you look at, this is a good one right here. Are you able to see that right here?
It's still on the general exercises for good. It's still on the calf stretch.
Oh, got it.
I think you might have to stop share and.
Yeah, I'm just gonna paste it on here just for simplicity. Oops. There we go.
Okay.
So this is a front view of your low back. So if you're looking at somebody's belly and you pull away all the layers, you have all these nerves that are exiting from your spinal cord, right? And they travel all the way down. So, and I forget the pattern. I would need to look at a picture, but you know, your L4, for example, will correspond to one area of the lower leg or foot. And you'll, you know, and then S1 over here will correspond. I think actually it might be S1 or L5 that corresponds with the big toe. And you know, you may have like a pinched nerve over here. And so what they're doing is they basically just cut off that part of the nerve so that way it's not irritated anymore. But the real source of the problem could be, doesn't mean that it absolutely is that this nerve is pinched. And so you actually have a back issue, not a foot issue. And then we would go, I don't know if you remember the previous presentations, but we would go into mobilizing the low back, trying to off-weight that nerve, stabilizing that area through the glutes and the stomach muscles. So that way you can give more breathing room for these nerve roots.
Okay, and then my L4 and L5 are kind of messed up. They're out of line.
Yep.
So that's probably where the pinched nerve is affecting my foot, right?
It could be. So L4 is here, L5 is here. Yeah. And if you have this disc is coming out and it's pinched one of these nerves, it's sending a message all the way down saying, we have something going on back in the chain. But it doesn't necessarily have to be at the root. It could be down along this chain. So it could be, you know, obstructed in the glutes. There's a muscle there called the piriformis. Sometimes that's the culprit, or even further down the chain. But
does rolling help that? Like rolling on a roller on the floor or something? Does that help that?
I wouldn't roll this area of your back if you have a
no, but like the side of your, like from your hip or from your thigh, the top of your thigh down to your foot.
Yeah, you could do that and see how it feels. But yeah, because that would stretch out.
It hurts a lot. I know that.
Yeah, so you want to figure out if that's a good pain or a bad pain.
Okay.
Similar to the sister. I'm sorry, I don't know your name, but she was mentioning that the therapist will massage and it hurts, but at the end of the day, then it's like, oh, well, that feels pretty good. So you should have a similar phenomenon.
Okay. And should you ice after therapy? Should you always ice?
There's no harm in it necessarily. Ice is good for pain reduction. It's good for reducing inflammation. You know, generally speaking, I would say ice is a good idea. But
okay.
Ice so if you just work really hard to loosen everything up and then you ice, you might stiffen things up a little bit.
Oh, okay. Because this is off topic, but I hurt I think it's my tailbone, like right down at the very tip of the spine at the bottom, because we were on a boat and they were going too fast and we kept like hitting it, you know, like hitting the waves really hard. And it's been like 2 weeks and I still have pain. I wondered if ice would help that. Yeah,
that probably could, just because it's probably bruised.
Yeah, okay.
You have like a tailbone bruise, most likely. I remember when I was a kid, I went down a slide and the slide had a big bump and I landed on my tailbone and it hurt for a while.
Yeah, this is it, yeah. Okay.
Dr. Omar, what is your take on the Dr. Scholl's inserts, those measuring machines that we see in pharmacies?
Yeah, so, you know, it's funny you mentioned that because I have a resident here. He was requesting it, so I got him some, and I mean, he loves them. I do know people that it works for. There was another brand that I used to recommend. I want to say it's called, I'm going to Amazon really quick. It was a little more technical, at least in my opinion. I think it was called Super Feet. Let me see. Yeah, this is it. So Super Feet Orthotics. They're sort of like a Dr. Scholl's. It's a little more technical in my opinion because it'll give you different options, like do you need a higher arch, a lower arch, that sort of thing. And they're a little more expensive, but I think it's worth taking a look at. You'd be able to ask a therapist if or even a doctor, you know, which one works for you. But just generally speaking, yeah, I mean, I'm not opposed to, you know, the Dr. Scholl's orthotics. I just think that it comes down to the individual and why they're using it. But I always encourage people to try to live without the orthotic if you can. The orthotic is an assist that really stops your muscles from working as much. So a lot of people will use like a postural, I don't know if you guys have seen them. There's like these postural belts that you strap on across your chest and upper back, and it pulls you in a good posture. I mean, that's great, but you're stopping your muscles from doing a lot of the work, and you want your muscles to be the ones working. So in some cases, orthotics are absolutely needed, and you can't get away from that. But you want to train your muscles to do as much of the work as possible.
So get them when you're recommended to get them, basically, or that's what you're saying.
Yeah, exactly. Because if you're just getting it just as a Band-Aid solution to help your pain, yeah, you solve the pain, but you're not activating those muscles. So like in this picture, let's say you have a tendency to be flat-footed like this, and you use an orthotic to give you an arch, so you're more in this position, the top one, and that's great, but you basically just stopped your muscles from doing what they need to do.
Yeah, I tried Dr. Scholl's too, but it's like, you know, one size cannot fit all.
Yeah.
That's then I had to go for the prescription ones.
Yeah, and that's the other thing is that they are kind of general. So I found that the super feet were a little better.
That sounds good.
What about when we go for, I went for walking shoes and hiking shoes, and it was that place, I forget what it's called now.
Snail's Pace?
What is it called?
Snail's Pace?
No, not that one, a different one. It's a store. And
Lucky Shoes?
I'm sorry?
Lucky Shoes?
No.
SAS?
No. It's one his mom always goes to. Anyway, they did insoles for me by my, like I had to stand on a machine, and then they did the foot imprint, and then they made orthotics just for me, but it was a shoe store. And
Walking company.
Oh yeah, walking company is pretty good.
Yeah.
Yeah, I just wondered it. So you're saying not to do that, to use your muscles instead?
No, I'm not saying not to do it. I'm saying you want to try to train your muscles as much as possible before you go to that. Or if you are going to go to an orthotic, then make sure you're doing exercises to counterbalance. So like the classic example would be, I would have a patient that, and we have a shout out here from Nigar Rangunwala. Sorry if I mispronounced that. She says, I got super feet for my plantar fascia, it helps. So see. But let's say that your capacity before your plantar fascia or whatever the situation is flares up. Let's say the capacity is a 20-minute walk. And then after that point, you can't handle it. I wouldn't say wear it in the first 20 minutes because you're just shutting off those muscles. I would say put them in your bag or your purse, walk the 20 minutes without it, you know, and then try to focus in on the proper foot positioning after the 20-minute mark. And then when you're at the point where it's like, this is the point of no return, or if I continue, I'm going to be miserable for the rest of the day, then put the orthotic in. That's
okay.
And if you are going to do the orthotic, then continue doing those exercises to maintain that proper alignment that you need.
Okay.
Yeah.
All right. Well, it looks like we have no more questions. Thank you so much. Right on time. It's always nice to see you, Dr. Omar. And I think you'll come back in September on the 2nd, the first Thursday. We can discuss offline what topic it will be at the time. But you've covered so many different parts already, right? You've done the back, I think, and now the ankle, the feet, and one more. I can't remember the other one that you've already discussed.
Like mid back or neck.
Okay.
But if you guys, you know, I'm at your disposal. If you guys want me to continue, I'm more than happy to. If you find benefit in this, I'm more than happy to continue. But if there are things that you want a little different, if you want me to focus more on just like an exercise program, if you'd like whatever it is that you would like more of or less of, you know, just let me know, and I can adjust.
I do know that there was a request for something in relation to the knee. If that is a topic we can talk about in the future, it's up to you.
If big on knees, knees are, I mean, I worked a lot with knees. I'm much more comfortable with knees than ankles or feet. But just in terms of content, like if you want certain things emphasized, I can do that.
Olivers, this is your time. Let Dr. Omar know. Would you like more exercises? Yeah, you can let him know later also, or let me know. Yeah. But yeah, I think a good mixture of both would be great. Like, you know, maybe showing a few exercises while doing them practically would be a good idea. Just because sometimes, you know, when you see those pictures, you don't know how it looks like in real life, right? Like you see the exercise pictures and you don't know how it's supposed to actually look like in person. So
right, it's pretty theoretical. Okay.
All right, so that would be nice, I think. But again, thank you so much for your time, Olivers. I will see you next week.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.